The right to die with dignity is a current issue being explored in much of the United States. This is not to be confused with euthanasia or the withdrawal of life support, but it can be used interchangeably with physician-assisted suicide. Many people share the perspective that the right to die without suffering is a basic human right. Others have moral or ethical beliefs that contradict the options to choose. In either case, it is with careful consideration that I believe that an individual suffering from a terminal illness deserves the right to determine for themselves when that suffering is too great. As a student pursuing a nursing career, I am aware I will encounter and care for patients in the end stages of life. I became interested in the right to die movement about a year ago and decided to do a research paper on the subject to gain a better understanding of the laws and to take an educated stance on the issue. I was elated by my audience response in being in favor of the movement, but I believe it's important when taking a stance in support of a sensitive issue that one should be well educated. Today, I would like to take the opportunity to clarify the regulations, provide you with an example of the criteria, and also remind you of one of the most nationally recognized utilizations of the Death with Dignity Act, so that you can take action in confidence where you stand. First of all, I'd like to bring to attention the fact that the decision between a physician and patient to end the patient's life is not taken lightly. There are procedures to be followed and criteria to be met prior to receiving a prescription for life-ending medication. A fine line exists between what is ethically reasonable and responsible, which leaves room for debate, but medical professionals have always stood for doing what is best for the patient. Having these discussions can strengthen the relationship between physician and patient, and a patient should be able to trust their physician enough to talk about options for a peaceful death. It is the provider's obligation to actively listen to the patient while providing what the patient agrees is best for themselves. It is about options, and a physician-assisted suicide may or may not be on the table for some, but the option should still be available. That is why specific guidelines are in place to protect both patients and physicians from detrimental repercussions of voluntarily ending life. I asked my audience what criteria must be met for a patient to be able to seek physician-assisted suicide. None of the audience members were quite clear of the exact criteria to be met, but they were on the right track. Audience members mentioned extreme measures, incurable illness, and being in a clear state of mind as some of the stipulations they had heard of. They had also mentioned that they knew it was only legal in a few states. As audience members who are in support of Death with Dignity, I was glad to see that their ideas were concurrent with the requirements, but I would still like to expand on that knowledge so that my audience can defend their position with confidence. In order to request life-ending medication, a patient must be of legal age and mentally sound. The patient must also be in medically determined end stages of life. Oregon, for example, was the first state to adopt the Death with Dignity Act in 1997. Mary Erzek outlines Oregon's criteria in her article written for nursing titled Assisted Suicide, Unraveling a Complex Issue. The article states that a patient must make the request for life-ending medication on at least 3 separate occasions. The patient's physician, as well as a consulting physician, must determine that the patient's prognosis is 6 months or less. They must discuss alternative options such as hospice care, and a psychological consult may also be conducted if there is suspicion that depression is influencing the patient's decision. If all criteria are met, the physician may legally prescribe a lethal dose of medication. However, the physician still reserves the right to refuse to put out a prescription. In addition, the physician must not administer the medication. It is only to be administered by the patient themselves. One of the most well-known cases in Oregon was that of Brittany Maynard. Tony Stockenstrom covered her story in the article titled, Is Dying a Pro-Choice Issue? Brittany Maynard was only 29 years old when she was diagnosed with stage 4 brain cancer. The tumor she had resided in her frontal lobe. This caused Brittany to have sudden changes in her mood, caused her to stumble and have seizures. The tumor was taking over her life, and knowing that it meant she would endure much pain and suffering, she and her husband chose to move to Oregon to take advantage of the Death with Dignity Act. As Stockenstrom points out, Brittany chose to speak freely about her decision prior to taking her medication, which put the spotlight on the Death with Dignity movement. The commonalities among those in favor encompass autonomy, that dying is a choice, and that those enduring intolerable suffering may invoke the right to end that suffering. For humans to simply possess that choice may bring peace of mind for those in fear of the pain that life's ending stages may bring. Brittany chose to end her own life without pain, surrounded by those she loved most. Since the passing of Oregon's Death with Dignity Act, states have slowly but surely begun to make progress by developing their own versions of the bill to provide death with dignity to their residents. According to deathwithdignity.org, only 5 states have legalized the process, and 1 will allow it with court consult. I asked my audience if they believe that people who meet the criteria should have the choice to end their own lives, and all responses were in favor. So now I ask my audience to take action. According to deathwithdignity.org, Wisconsin's bill was stalled in 2016, but Senator Fred Reiser has plans to bring up the bill again in 2017. You can support the cause by visiting deathwithdignity.org and taking actions such as signing petitions or writing a letter in favor of the bill. Ultimately, choosing to die peacefully with lethal medication is a personal decision. Individuals all have a different story, and in the end, the decision should be made by the individual and the provider of the medication. I hope you've gained a better understanding of how carefully thought out the process is, and that the example of how Oregon's laws are put into place will clarify your ideas. With the remembrance of Brittany Maynard's story, I hope you will join me in taking action to make this sensitive decision available to all individuals in all states.